Hi, my name is Brandy Ivy, and I'm a community educator with Right at Home. Today we're going to talk about seniors and driving. Before we get started, I'd like to tell you a little bit about Right at Home. We provide caregivers in the home for people who need a little bit of extra help, maybe with toileting, bathing, getting dressed for the day, running errands, housekeeping, meals, just about anything that a loved one would do for a senior who needs a little help. If we can be of assistance in any way, feel free to reach out and give us a call. We have offices in Huntsville and Decatur, and we would love to help you out. So, the topic of seniors and driving. This is often a very hot topic because there's just really no definitive answer, no one size fits all for this. Let me give you a little bit of background about how I learned about seniors and driving. When I was in college at UAH back in 2005, I was working on my senior research project. I majored in psychology and sociology, and we had to do a senior research project. There were a couple of choices. One was studying eyewitness memory of crimes, and it was, very interesting and cool. So of course I wanted to be a part of that one, but I didn't get my wish. I got assigned to a study on seniors and driving, and I thought, oh, why do I have to do this? I'm not interested in this. I'm never going to work in senior care. And, God has a funny way when you tell him your plans of working things out. And here I am today with a career in senior care. And it actually is very interesting, and I really enjoy it. So that's how I learned about seniors and driving. For our research project, what we did was we found as many participants as we could, and their ages ranged from 65 to 94. And they had education levels from 4th grade all the way up to a PhD level. Really just any older person who was willing to be a part of our study. And one thing we looked at was called the useful field of view, or UFOV. So this is not a new concept. This was introduced back in the 1970s. Basically, it examines your range of view. If you're looking straight ahead, it's everything that you can perceive around you without actually moving your eyes or your head. So kind of like peripheral vision. If I look straight ahead, I can tell you what's over here and over here, but I will get to a certain point where I can't really detect that any longer. It's too far out of my useful field of view. So there's actually a test that's been developed to determine an individual's useful field of view. And it's a computer test, and it's kind of like a game, really. It's been used for people with dementia, also with strokes, traumatic brain injuries, all different sorts of issues that might have an effect on driving. So the first thing on the computer test, an image of a car will pop up and then go away. And then you're supposed to click, where was this object? It will also show you an image of a car or a truck, and then you have to tell them, was it a car or a truck? As the test goes on, they'll add extra pictures all around, what they call distractors. They'll add little triangles and things. So it gets increasingly difficult to tell the computer what you saw when you have so many different things distracting. So at the end of the test, it will give you a determination of your useful field of view. And here are the things that the results tell you. So if you got a good score on your useful field of view test, this means you've probably got better abilities on your activities of daily living, your mobility. And on the other end, if you have a lower score on this, your speed of processing is probably slower, and you're more likely to have an impact on your driving ability. So it's very helpful in determining. Another thing we did was just a good old vision exam. We're not eye doctors, obviously, but it's easy to get out an eye chart. You put it in a darkened room, and the chart is lighted, and then you just have the person read what's on the eye chart. If anyone was found to have, significant issue with vision, obviously we would send them to their eye doctor, and they're going to need that kind of help as well. And then another thing we looked at was called a mini mental status exam, or MMSE. And this is a common thing that's used to kind of help diagnose dementia. It's not the only way. It's not going to definitely give you a dementia diagnosis, but it is a good test to kind of help you determine if somebody has some cognitive issues. It's going to measure the person's attention, their orientation, so do they know who they are, where they are, that sort of thing. Their memory, and their language, and their construction skills. You know, can they put a simple task together? It's really a nice exam because it's quick and easy, and it can kind of be worked into conversation without it being very intimidating. It's almost like a game. Questions such as, what is the date? Where are we? What floor are we on? Name 3 objects. You know, repeat them. Simple objects like a chair, a bed, a shirt. You may hold this up and say, what am I holding in my hand? Or, you know, tell me what this is. And it's generally simple things, but if you have some cognitive issues, it might be a little more difficult. You may ask the person to draw a shape or write a sentence, draw a clock, those sorts of things. So that's the MMSE. So here's what the research findings were. After this whole big research study, it spanned several years, and here's what the results were. So these are what you'd call clinically significant. These are ones who have been closely studied. The number one factor that indicated a risk for unsafe driving was age. The older the person was, the more likely they were to have an issue with driving. Also, a person's overall health, vision, mental status, and education level. So the folks who had lower education maybe had more trouble than those who had higher education. Now, here's the thing to keep in mind, though. This result is not every single person. This is going to be overall in general. So what that means is, let's say you have a 95-year-old person and a 65-year-old person. And would you automatically say that the 95-year-old is going to be a bad driver or an unsafe driver, and the 65-year-old is going to be great? Well, no, because what if the 95-year-old is in great health, has great vision, no cognitive problems, sharp as a tack, and highly educated, and then you look at your 65-year-old person who has several health problems, very poor vision, a lot of cognitive issues, maybe dementia. You know, which person would be a safer driver? It would be your older driver. So it's not every single person, but those were the best indicators of problems with your driving. So, you know, the problem that seniors have with stopping driving, it's not as simple as just saying, okay, it's not safe to drive anymore, and now let's stop. You're going to get a lot of pushback from most seniors. And it's obvious why that is. Nobody wants to lose their independence. You know, we all like to do what we want to do when we want to do it. We don't want to be a burden on other people. We don't want to have to wait on other people to do the things we need to do. Or it just really kind of makes you feel more dependent, and nobody really likes that feeling. We all get used to just hopping in the car and going when we want, and if you can't do that anymore, that's a big deal. So it's caused a lot of arguments between seniors and their loved ones, their family members, who really only care about them and want to do what's best for them, but it's a fight a lot of times. So driving at night is a biggie. So a lot of seniors will admit that driving at night is harder. It's typically because as you get older, your pupils don't dilate as quickly or easily. Your corneas tend to cloud. So some people wear amber colored driving glasses. I know it seems funny to wear sunglasses at night while you're driving, but it can really be a good modification that will help seniors to keep driving longer and safely. So 10 warning signs that you need to worry about your loved ones driving. Those mysterious dents in the bumper. You know, you come over to see your mom or dad and you notice there's a new dent, unexplained, maybe makes you kind of nervous. Trouble turning to see when you're backing up. So, you know, you got your hand on the wheel and you're trying to look over your shoulder. And if that range of motion isn't that great in your neck, it can be hard to see when you're backing up. Confusing the gas pedal and the brake pedal. Increased irritation when you're driving, you know, and when it gets to be a more difficult task, it gets people kind of agitated about it. Misjudging on left-hand turns. So, you know, left-hand turn means you're probably going to be facing oncoming traffic, and you've got to make a decision as to when it's safe and clear to go, or if you need to wait for more cars to pass. You can see how that would be pretty dangerous. Number 6, when parking is difficult. We've all seen seniors that have just a really tough time parking. They're double parking, they're crooked, they're over the line. When driving and a senior has difficulty staying between the lines, that can be an indicator. You know, a lot of the lines on our roads are faded, difficult to see. So it can be hard when you see somebody weaving in and out of those lines. Number 8, delayed reaction or response times. That ability to react quickly is so important in driving. Driving the wrong speed, you know, driving too fast and driving too slow can both be equally dangerous. And riding the brake, that one's a big one too. You know, if you're constantly nervous that you're going to have a problem and you're hitting that brake, it causes problems with driving. So those are 10 things to look for. Reasons that driving might be affected, you know, that speed of processing we talked about. You could maybe take a long time to get dressed in the morning, but you don't really have a long time to make a decision on driving. Those have to be quick, spur of the moment decisions. Your physical abilities, like we talked about that range of motion, you've got to be able to physically drive if you need to drive. Cognitive abilities, understanding the rules of the road, remembering how these things work, what the traffic signals and signs mean. Navigating your route. You know, if you're cognitively thinking, okay, I know how to get to the grocery store, and then you run across a detour or some road work and you need to go a different way, can you do that? Can you think of a new way to go, or are you kind of stuck? Medications are a huge issue. There's so many medications that make it difficult to drive, and not just for seniors. And vision, of course. Glaucoma, cataracts, macular degeneration. Vision is a huge one for seniors and driving as well. So first thing that's good to do is have a talk with your senior loved one. I know it's very touchy and kind of makes you nervous because you probably know this person pretty well and you know how they're going to react when you bring up a touchy subject. But it's the first best thing to do. Let them know you're concerned. Maybe make some suggestions such as, can I take you to the doctor this week? How about you drive and I'll ride with you so you can maybe see how the person's doing. Talking about mom or dad's schedule for the week, what you got going on. Well, how about I go with you, or maybe a friend can drive you. Just kind of having those conversations that you may not want to have, but you need to have. So if the conversation goes well, then great. You can come up with, you know, some solutions together, whatever they're willing to do. But what if the conversation doesn't go well? And I've seen many times that the conversation does not go well. People get very offended when you say, I don't think it's safe for you to drive anymore. They feel like you're accusing them of being feeble-minded, senile, not able to take care of themselves. People can get really offended. And most of the time that's not what's intended, but it's just a very touchy subject. So one thing you can do is remember to keep it more about the disease or the issue that's preventing them from driving safely and not them as a person. You know, just remind them, Mom, it's, you know, I know that you're a great driver, but since you've got macular degeneration now, it's just probably not as safe. Or, you know, the doctor said, well, since you've had a stroke, we really need to take some time off from driving. Remind them that it's about that medical condition and not a personal flaw. Another thing to do is consult an occupational therapist. We've actually got a local occupational therapist who will do driving assessments, and it's a great sort of middleman. You know, if you can't compromise on, yes, I'm driving, no, I'm not, consider getting a driving assessment done. Our local provider is Therapy Achievements. They're located in Huntsville, and it's run by a lady named Karen Hislop. She's an occupational therapist, and she will do a driving assessment, and she'll actually get in the car with the person and see how they do. She doesn't always tell people you just have to stop driving completely. Sometimes she can help you come up with modifications, like maybe extra mirrors, built up controls or pedals, extra different seatbelt attachments. So there's different ways that you can continue to drive, but safely. And have a backup plan so that, you know, you're not just saying it's time to stop driving and that's it. Have some suggestions in place, like, well, I know of other companies who can help you. We'll talk about some of the options here in just a minute. But have a backup plan in place when you talk to the person so that they don't feel like that's it, I'm never leaving the house again. So a question that I get asked pretty often is about the laws in Alabama. A lot of people want to maybe make the state of Alabama the bad guy, you know, well, they just said you can't drive anymore. Here are the laws. Here's how it works. So there's no maximum age for having a driver's license. There's no time that you are too old to drive in the state of Alabama. You also don't have to take an examination to renew your license at any age. It's highly debated. Some people think you should have to after a certain age. Of course, the older we get, the more we're like, I don't need a re-exam to drive. I'm perfectly fine to drive. As long as I have a license, I should have every right to drive. But if your license has been expired for 3 years, you do have to take a re-exam. So if your senior loved one has forgotten to renew their license 3 years in a row, they will have to take an exam to be renewed. So that may be one way that things sort of work themselves out. Also, if there is physical or mental impairments suspected, the Department of Public Safety can ask someone to take a re-examination before they will renew the license. Now, that doesn't mean that anybody can just call up the Department of Public Safety and say, hey, I really think my dad's not safe to drive. Can you ask him to take an exam? The state's just not equipped to do that for every, you know, concern that's out there. Unfortunately, a lot of times it takes something bad happening, like a crash or some issue like that, before a Department of Public Safety will ask for a re-examination. But physicians can send in a report recommending it. So if a primary care physician were to send in that report, and they know how to do that, they all know how to do that, that may result in the senior being asked to take a re-exam for a renewal. So some of the misconceptions that seniors have is that it's just cheaper to drive yourself. We'll hear that argument a lot. And, you know, you can point out, well, Mom, but when you think of the price of your car, gas, insurance, maintenance, repairs, it's a lot of money. And if you don't have to worry about all those things anymore, that's more of your money that you can spend on other ways of transportation. People feel like the alternatives are just less convenient. And that can be true, but there are options that can be pretty convenient. Also, they'll say, well, I'll just never see anybody. I'll never get to go anywhere. And that's not necessarily true, because friends and family can always pick you up, take you places with them. And that actually keeps seniors from being so isolated. They get to spend more time with a friend from church or a friend from their bingo group or whatever with their son or daughter. It's great together time when you're riding with somebody. So public transportation is one option, but there's a few things I want you to know about public transportation. So a lot of times when you have like Handy Ride, like in Huntsville, or the tram, things that are designed for disabled folks, being older is not enough of a reason to qualify you. You have to actually have a documented disability. So that's one issue you need to keep in mind with public transportation. And if you do qualify, those rides are usually just for medical reasons. They're just going to get you to appointments with your doctor and back. It's not really going to be a good source to just take you out shopping or to church or things like that. And they normally only run in like city limits or a certain area. They don't typically go into the suburbs and places like that. So if you live in a neighborhood, it can be a little difficult to get to the stops where the transportation is going to pick you up. And a lot of times those public transportation sources do not get you out of your house and to the vehicle. They'll only get you on and off of the public transportation vehicle. So if you need help getting out your front door and down your steps, they're not going to be able to help you with that. So just good things to keep in mind. Public transportation has its purpose and it's great. I'm so glad we have it, but it does have limitations to it. So we have other options like Elder Ride. It can be a little costly. I think a lot of times it's around $60 round trip. But they're a very good service and they take good care of people, and they'll pretty much take you where you want to go. If you're paying, they'll take you. You can bring an assistant to ride along with you if you want, so that's helpful as well. Uber and Lyft are getting to be really popular and even popular among seniors. You would be surprised how many have gotten proficient at setting up an Uber ride. They've met their favorite drivers and they're really good at just handling it themselves. You can do it all on a smartphone. You can have it paid through your credit card. So it's pretty convenient and gets the job done. And of course, right at home, caregivers will do transportation for you. You'd be able to either ride in your own vehicle and have your caregiver drive you, or sometimes we've had caregivers ride along with their clients on an Uber ride or a Lyft ride. So a variety of different ways that you can still get out and about without having to completely stop driving. So to wrap everything up, there's ways to assess whether a senior is still safe to drive or maybe needs to modify or stop. There's been good research done on the factors that contribute to unsafe driving. There are lots of great alternatives, so you don't have to just completely stop going and be just sitting at home away from everybody. And even though these conversations can be really tough to have, definitely try to have the conversation and come together in a way that reminds your senior loved one, we care about you. This is for your own good. We don't want to see anything bad happen to you or other people on the road. We just want to make sure you're taken care of and still enjoying your golden years to the maximum. So if Right at Home can be a help in any of those ways, please reach out and let us know. We're always happy to help. And good luck and stay safe out there. Have a great day.